I'll call the meeting to order and I'll ask the secretary to call the roll.
Bryan, Parker, Barnett, Blackwell, Blunt, DeBar, Fillingane, Frazier, Harkins, Hickman, Hill, Hobson, McMahon, Parks, Polk, Tate, Turner Ford, Wiggins. We have a quorum.
The people in charge of the HVAC systems are obviously under the impression David Letterman was going to appear, and they've got the temperature fixed just the way he likes it. We may send out for electric blankets if we need to get through the hearing. The first item on the agenda is House Bill 42, which is the rural dental scholarship program. It would name the program for an individual in section 2, which I think is the first change. And then it would increase the number of students. This primarily is a appropriations matter. And so it's doubly referred to appropriations. But that's what the bill does. Is there a motion, title sufficient to pass? Okay, is there debate on the bill? Are you ready to vote? All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. We'll report that to the Appropriations Committee. House Bill 317 provides for a memorial for emergency medical technicians and others who were killed in the line of duty. This memorial is to be at the State Department of Health. The State Department of Health tells me they support the memorial and that their confident funding could be found for it. So is there a motion on that bill? There's a motion, title sufficient to pass. Is there further debate? I'll point out again, this is doubly referred to appropriations. Seeing none, the vote recurs on title sufficient to pass House Bill 317. All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. We'll report that to appropriations. House Bill 728 is the 340B drug discount program. I believe the bill before us is essentially the bill that we passed earlier. Just looking for Senator Wiggins, but is there a motion on that bill? There's a motion, title sufficient to pass. Senator Blackwell.
For a question, Mr. Chairman.
Yes, sir.
I noticed in the bill, we talked about having distributors, and I think there's at least 30 other states that have done this and don't use distributors. And if I'm not mistaken, we got this model came from Louisiana, which does have added distributors. Is there a reason we're having it, or is there a good reason why the other states didn't include distributors?
I think that question is probably better directed to Senator Wiggins, who hasn't made it here yet. Why don't we entertain a motion to table subject to call, and we'll come back, and Senator Wiggins, I think, was sort of in charge of that.
All right, thank you, sir.
Is there a motion table subject to call? All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. House Bill 760 is the grant program for qualified health centers or qualified health center grant program. It's to help underwrite the cost of physicians. This is the same bill that we passed earlier in the session. Is there a motion, title sufficient to pass? Is there debate on the bill? Seeing none, the vote recurs on the motion, title sufficient to pass. All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. House Bill 1030, authorize the Department of Human Services to enter into a lease with counties having local offices. This is identical to a bill that we passed earlier. There's a motion, title sufficient to pass. Is there debate on the bill? You ready to vote? All in favor say aye. Opposed, no. The ayes appear to have it. The ayes have it. House Bill 1129 is a bill to move the Office of Physician Workforce from the Mississippi University of Mississippi Medical Center to the Department of Health. I'm informed that there's no opposition to the bill. The bill, the strike all amendment, which is, I think, in your package, has some technical provisions. It's not. The amendment is mistakenly in the package. So we're back on the original bill. So the bill moves the Office of Physician Workforce to the State Department of Health. I think there are technical changes to some of the advisory, not advisory boards, but I think those are not earth-shaking. So there's a motion, title sufficient to pass. Senator Blunt.
So the motion is just on House Bill 1129 and not the strike all amendment in the packet. Is that
I'm
right?
told that's correct. I'm told the strike all amendment was not supposed to be there.
Thank you.
We're on the original bill. Ready to vote? All in favor say aye. Opposed, no. The ayes have it. House Bill 1376 involves qualified residential treatment programs. This is identical to a bill we passed earlier. It allows the placement of children in a facility which is particularly appropriate for the needs of the child. It's I get confused with all the technical terms, but this is another alternative that the department would have, and it's identical to a bill we passed earlier. There's a motion, title sufficient to pass. Debate, questions? All in favor say aye. All opposed, no. The ayes appear to have it. The ayes have it. I think for technical purposes, we still have House Bill 728 on the table. But for all the other bills, if there's no objection, I was going to ask that we consider that a motion to reconsider has been entered and tabled on each of those, which would allow the staff to go ahead and process these bills and get them up to the docket room without waiting for the hearing. Is there any objection to that? If not, we'll consider all those bills to have passed. The motion to reconsider having been tabled, that will allow you to file a committee report, and we still have that bill laying on the table. We now are going to have a hearing on the bills regarding intoxicating hemp. Apparently, there is being sold in a number of places a variety of hemp, which although not technically within the restrictions on selling intoxicating substances, in fact, is a de facto intoxicating subject. And we have here Dr. Edney, the state health officer, and people acting in concert with him. So Dr. Edney, whoever you would suggest come talk to us first. If you have a handout, this is a good time to pass out a handout.
Thank you, Mr. Chairman and committee members. I always appreciate an opportunity to come visit with you. What I want to do, just in terms of the public health and the health department's role here, is to emphasize that this is indeed a problem from a public health standpoint. Recently, there 20 attorneys general wrote a letter to Congress outlining what states are dealing with due to the loopholes that are in the most current farm bill that relates to the hemp program through the USDA and what's happening not just in Mississippi, but really happening across the country. What is supposed to be happening is that products that contain less than 0.3% active THC, especially Delta 9, that those be considered legal under the hemp authority, which I would have no problem with that, as that is not an intoxicating level. And if it is a pure product with no adulterants, then I would see no danger to the public. Unfortunately, we're seeing across the country, due to a lack of basically any regulation, that these products are the Wild West. And I can tell you from my years in private practice as an addiction doctor, as I was doing drug screens on patients and they were showing hot for THC at a significant level, and patients that I knew and I was convinced were not abusing, they were using CBD products that were available over the counter legally. And none of us had awareness then that there was enough THC in many of those products to light up drug screens, which means it also puts Mississippians at risk of failing drug screens at work. If we have a properly regulated product that's 0.3% THC or less, that's not an issue. That's not going to fail someone for a drug screen. A big concern for me is, we're having a conversation about intoxicating hemp, which there should be no such thing. By definition, if THC level is high enough to intoxicate, then it's not hemp. It's cannabis. It's the same plant. We're not talking about growing two different types of cannabis sativa. You're looking at the parts of the plant that are low THC being processed into cannabinoid products and trying to get to as pure level CBD as possible versus the flower, the bud, the other parts of the plant that generate much more THC, or you're genetically trying to engineer a low THC producing plant. The fact that we do have just with random testing has been reported, samples that are ranging high enough that they would fail to be in the cannabis program, much less being over the counter is a significant concern to me. But then also to have products that are failing for pesticides and mycotoxins, things that are, we look at hard in the cannabis program with our testing, and that being found over the counter without regulation is of significant concern. So the problem is real. The problem is manageable. And we at the health department, one thing we are not experts in is intoxicating hemp, but what we are experts in are taking difficult projects that you deem necessary and important, and then work them into operation as best we can to be compliant with what your expectations are for us. I can tell you that the bill before you does have challenges for us to enact as written, basically nothing intentional, but just substituting the health department in place of the Department of Agriculture. Really, it doesn't work. It doesn't work for us to be interacting with the USDA in terms of regulatory fashion like the Department of Agriculture would do. This is not a health department specific bill, but like the cannabis bill originally was. The cannabis bill was directed towards us in revenue. We would need some significant discretion to allow us to build the program however directives that you would give us, but it would be extremely difficult to operationalize the bill as currently written, but not impossible. There, are many ways to regulate this. I obviously defer to your good judgment and what is best for Mississippi in terms of regulating it on the shelf, and whether it's us or revenue or NBN doing it, that would be your discretion. But the issues of paramount importance that must happen, there must be a testing component. We must regulate these products to some degree to show that what the public is buying and having access to is indeed what's being marketed. And so, low THC products need to be low THC products, and they need to be free of adulterants. They need to be free of poisons of various types. And NBN has testified that they have found in many vape shops vaping cartridges that actually had fentanyl. So that what we're doing now is not working, and I do think it endangers the public just because of its lack of regulation. Should you choose to send it to the health department through the cannabis program, we would ask that looking at the bill, we have concerns regarding enforcement authority. We have some limited law enforcement authority, but we partner very closely with Revenue in terms of law enforcement and with NBN. And when we need guns and badges, those are the folks we call. And we would need some law enforcement support as we do this. We would need language that's more health department specific, and we would need the ability to determine what's going to come in from out of state, because if something is 0.3% THC or less, then it's legal at the federal level. You would have to make it illegal for those low THC products that are appropriate to be outside. And whether we're going to allow out-of-state transfer of product would be up to y'all. But I think the bill is working hard to accomplish something that's very much needed. We would just ask for help in terms of enacting whatever the legislature decides, and to give us some time. Please give us some time and some discretion to bring back and enact the type of program that you would like. And those are our main concerns, sir. Happy to answer any questions.
Thank you. I want to make it clear, we're not voting on anything connected with this today. It's just a hearing for us to discuss the issue. So are there questions? Senator Blackwell.
Thank you, Mr. Chairman. Thank you, Dr. Edney, for
Yes, sir.
your work on this. And with what you and the program, the department have done with the cannabis programs have been excellent. If I'm hearing you, some of the language that we had in the cannabis bill to allow you to interact with the Department of Revenue and other agencies, is that language, similar language needed in the bill?
We think so, sir. And I do really want to support our partnership with the Department of Revenue. I can't tell you how valuable that is. And it's an incredibly effective partnership. And we're trusted partners both ways. So we would very much like, and now Commissioner Graham may not be happy with this, but I'd be very happy for them to be partners with us with whatever you decide to do.
Well, currently, as far as the cannabis program goes, they are involved. There's the badge and the gun, if you would, with the revenue officers.
Yes, sir.
These products would be sold in dispensaries, so to me, it'd be an easy, they're looking at two different shelves, if you would.
That's right.
You're going to be looking at the medical cannabis shelf, and then there'll be the intoxicating hemp shelf. Is that right?
Yes, sir. And we're very comfortable in the testing regulatory space, transportation, disposal, that type stuff. But we defer everything related to the dispensaries to revenue, which is where their authority is.
Thank you, sir. Thank
Yes,
you,
sir.
Mr. Chairman.
Thank you.
Seeing no other questions, thank you, Dr. Edney. Dr. Welch, or
Thank you,
are
Mr. Chair.
you going to visit with us now? And you've been nice enough to pass out a handout. So if you could tell us your views on all this, we'd appreciate it. No, no one can hear because
There we
we
go.
have this
Sorry.
very fine
It's always a
sound
trick.
system. And you have to speak directly into the microphone.
Yes, sir.
I'm told reliably that people listening to us from afar out there on the internets, they can hear just fine. But those of us here in the meeting can't, but you do have to talk right into the microphone.
Yes, sir. All right. I think I can handle that. Robert Welch, I'm a pharmacist. I'm the director for the National Center for Cannabis Research and Education at the University of Mississippi. I'm not going to belabor a lot of what Dr. Edney had covered about this being an issue or a problem, not only in Mississippi, but in a lot of states. I would just like to point out a couple of things that we have done at the University of Mississippi. It's on the handout there under our research. We actually had two studies that have been published, one in 2020 talking about CBD predominant products. Because if you'll think back about the Agricultural Improvement Act of 2018, the Farm Bill as is more commonly known, this is where the problem kind of stems from that. You know, folks figured out, okay, we can sell CBD products now, but they quickly found the loophole when they discovered you could also have derivatives. And that means that you can chemically synthesize very highly intoxicating products that start from a low THC standpoint. So they're covered at that point, but you can add chemicals to those products and easily create these Delta 8 products, Delta 10, THCP, THCO, and so forth. So in 2020, we published a study. We, with the help from our agents in the state, confiscated or they bought undercover, I should say, in the state, 25 different CBD predominant products. And as I've noted here, just to give you the gist of this study, only 3 of those 25 products had within 20% of what was on the label. So they're very inaccurately labeled. A patient may get one of these products. We also found that several of them had no cannabinoids whatsoever in the product. So they're basically throwing their money away at that point. They're not getting any cannabinoid product in some of those products. And so the other thing was that we had studied those and found that some of them had illicit amounts of THC, which obviously is not supposed to occur. So moving forward a little bit, when we started to see this explosion of these different cannabinoid products beyond CBD, the ones I mentioned a second ago, we did a study where we collected 11 Delta 8 specific products from around the country. These were not all collected from Mississippi stores. So we got these products, we tested them. They had several impurities in these products. Let's say, for instance, the label said there's 5 milligrams of Delta 8. Well, in some cases that might have been fairly accurate, but there were also many impurities. Okay, and so there were also other highly intoxicating cannabinoids that were found in addition to the Delta 8. So patients have really no idea what they're buying. It's hard to figure out where these products were sourced from. And it's hard to know really where they come from. And just to make a final point in terms of public safety, the CDC published some data. This was a few years ago. So if you look at some hospitalizations for children less than 10 years old, starting before the 2018 Farm Bill was enacted up until this particular data ends at 2021, you see a skyrocketing increase of hospitalizations of kids under 10 years old because they accidentally ingested these products. We all know that A lot of these products are very attractive to children. They're gummies, they're cookies, they're brownies, and so forth. And so, so that's very concerning because what can happen, you can get several side effects: anxiety, vomiting, dizziness, loss of consciousness, tremors, hallucinations from these products. Especially that was published by the FDA, that particular information. And then also I've talked to, anecdotally, I guess you could say, I've talked to some different state poison control centers, and they echo the same sentiment that they're seeing an uptick in calls about accidental ingestions. Mainly that's where they're receiving calls from parents who may have bought these products and their kid had access to them. And so they're ingesting these products really not knowing a lot about what is in them. And finally, I have talked to Dr. Edney's point, mentioned addiction specialists, and I've talked to several addiction specialist physicians in the state. And one of their concerns is their patients might be doing well in their program, but they have access to a whole slew of products in these stores that are not being monitored. The doctor, the nurse, the pharmacist, whomever is treating them may not be aware that they're accessing these products. So if we were to make this under the purview of the Mississippi Medical Cannabis Program, that would help with that situation, because at least someone's going to know that they're on these products because it's in the prescription monitoring program. These products, as it is now, you can go undetected until something untoward happens or a severe side effect. And so I think that's really all I wanted to point out, and I'm just happy to answer any questions.
Are there questions from members of the committee? Senator Hickman?
Thank you, Mr. Chairman. Just a couple of questions.
Yeah, sure.
In the study with the 25 CBD products from Mississippi, how many of these products had less, and what's the percentage that had less than what the label said, and what's the percentage that had more than what the label said, outside of 20%? Sorry.
Oh, yes. So there were only 3 of them that were within that 20%. There were actually, I believe, 3 that had no cannabinoid content whatsoever. And then the bulk of them either had, we looked at, from a milligram standpoint, let's say the package said there were 5 milligrams of CBD per unit, per dose. Some of them had down to 0.02 milligrams. And one product in particular had, I believe it was 268 milligrams. And they're saying that they had, 5 to 10 milligrams on the package. So the bulk of those products were over the limit that they said was in the product.
So they're basically all over the place, from the zero,
Pretty
none in there,
much.
to like huge amounts. One other question: can you the graph that's presented here?
Yes.
What's the acronym or the initial MPDS? What does that mean?
Let's see.
Cases per 1,000 MPDS.
That is a national pediatric database. Yeah.
So
this is pediatric data. Yeah.
So I'm saying this is the number of cases that involved CBD products over all of the pediatric cases that they were looking at over this period of time.
That's correct. These were basically from the call center that the FDA has set up, and through this was data from the CDC. Yeah.
And just trying to understand the data, but these programs, as you're describing, would have started an uptick around 2018, because that's when the Farm Bill was passed. So I'm guessing that this is a product of just that there being more products on the market, and that's why we're seeing that spike, and that's why we're seeing more cases for pediatrics.
Correct. And if you'll notice, so if you think about, and you guys may just remember this being the case, once the Farm Bill was passed, we did start seeing in our state certain stores that were called CBD stores, and they mainly sold only CBD predominant products. But as I said, once folks started kind of figuring out that there was this loophole where they could chemically synthesize that CBD biomass that was under the THC limit, then it just exploded. I mean, now you can see it's just a number of products that some of these, by the way, most or all of these products are synthetic. So there's no plant derived or natural based products in these, because the situation is such that in the plant, let's take Delta-8, for instance, there's trace amounts of Delta-8 in the plant. So you technically can't make a plant derived Delta-8 product. You have to chemically synthesize it. Now, if it's met with stringency and standardization of what's in there, it's not that synthetics are bad necessarily on its face, but it's just that you get inaccuracy when you have no regulation. That's really the point.
And I guess what I was getting to, and look like you've answered the question, is kind of both, whether products just became more widely available or whether products became more dangerous. And it looks like you're saying both.
It's both.
Thank you.
Yes, sir. Thank you.
Other questions? If not, thank you, Dr. Welch. We appreciate your coming.
Thank you.
I was contacted, I'm sorry. I was at this point going to hear from Emmanuel Williams and the people with him. Mr. Williams had contacted me earlier and said there were people who wanted to talk to us. So, Mr. Williams, do you have people in particular? Okay, or just go up here. And again, I'm sorry, but you need to speak right into the microphone. Thank you.
Thank you. All right, is that better? It was not on, thank you. Okay, I know a lot of you. I'm Julie Mitchell. I'm a cannabis attorney. I'm actually a healthcare attorney by trade. I've actually got a master's in health law, and somehow I segued into cannabis. And I think that, years ago, I thought that Medicare and Medicaid had a lot of complicated regs, but I'm here today to tell you the cannabis industry may be about to top that. With me, I am representing an alliance of over 500 storefronts that are involved and started out with the 2018 Farm Bill into the hemp industry. And that was prior to the Initiative 65. And that was under the 2018 Farm Bill Act, which legalized CBD derived from hemp. You can also derive CBD from marijuana, but we are not talking about that. We're talking about the CBD derived from hemp. And hemp is defined in the 2018 Farm Bill as cannabis that contains less than 0.3% Delta-9 THC. That is a legal definition, and it is a federal definition. All other products that are outside of that are legal federally, okay? So we're here today to talk about what the feds have legalized in terms of hemp. And that's kind of what we're here to talk about. I've got individuals here that are going to speak to you too, and they are both dispensary owners and CBD/hemp shop owners. Now, the law for hemp was not finalized into reg until March 20th, 2021. Okay, we had a lot of pilot programs, but it wasn't finalized until 2021. Interestingly enough, that's right on the heels of when Initiative 65 was being pushed. And I'll tell you that Initiative 65 didn't make it, as we all know. I had a lot of people calling me going, look, we want to get into the hemp program. And therefore, they applied through the USDA because Mississippi at that time was one of only 3 states in the entire United States that did not regulate their hemp program. We did not fund it. We passed a law. We authorized a 2018 Farm Bill under the Department of Agriculture, which is the bill that we're here to look at, which is the statute provision that we're here looking at it. We authorized it, but we did not fund it. And therefore, we deferred to the USDA to supervise and to administer and to license Mississippi hemp farmers in the state of Mississippi. In accordance therewith, the USDA has issued over, I think I said what, 584 hemp licenses to hemp farmers in the state of Mississippi. As of August, there were 584 active hemp licenses in the state of Mississippi. Okay. After that, we also, we've fanned forward, and I will tell you, I had a lot of people calling me going, look, marijuana fell through. I've invested, I've got greenhouses, I've got all these other, I've got land, I want to utilize it. How do I get a hemp license? And it was ironic to me. I think I probably called the Department of Health and said, we've got hemp licenses, and look, they have flowers on them that resemble marijuana, but they're called hemp. But we can put them on the license. We can put a picture of a leaf that is called hemp on the licenses all day long. This is a fast-growing industry. It's growing faster than we can regulate it. And the FDA is trying to regulate it. I think we heard a little bit about some of these products. The FDA and the DEA have been actively writing opinions to those of us that ask them for opinions, asking, is this legal or is this not? Incidentally, THCO, the FDA and DEA have written and said that is not legal. That'll get you very, very, very high, but it's one of those that we ginned up and created through synthesizing certain key components and extracting and pulling out and heating up the flower. And it created a product called THCO that used to be in the stores. People have now pulled them off the stores because the DEA has written and said that's illegal because anything that is synthetically derived is illegal and does not comply with the 2018 Farm Bill Act. So when we talk about synthetics, that's not what these people are selling in their stores. They are selling 2018 Farm Bill compliant hemp products. Okay. I will tell you that this bill that we're here talking about is in essence going to kill this program and those that started into this industry without the regulatory authority, without this particular regulation. Mississippi, again, was one of the only 3 states that didn't regulate this program when it started off through the 2018 Farm Bill. I think now there's 5 or 6 other states who have retracted their ability to regulate it and said, we're just going to throw our hands up because like the FDA, the DEA, and everybody else, we're so confused. We're chasing all these products and we don't know what they are. But what we are getting is as the FDA determines they're illegal, they are banning them and the DEA is banning them, okay? This industry in 2023 reported $28 billion in sales, $28 billion in sales. Mississippi, I may have said that wrong. We have 454 active hemp licenses. There are over 2,000 shops in the state of Mississippi that are engaging in these products. And when I talk about that, we're not talking about the ones that have been reported to the FDA. Those, the FDA wrote letters, sent letters out to every one of those that issued the warning letters and sent them to them saying, your product is illegal. Your product has been tested. It is testing over the legal limits of the 0.3% Delta 9 THC by dry weight. Hemp is legal on a federal level. Marijuana is not. A lot of our marijuana farmers went out and got hemp bills or hemp licenses so that they could grow both. You would think you could do that. But the USDA has gone into the state and said, if you're growing marijuana, you may not participate in the hemp program because marijuana is illegal, okay? I represent both. I represent, again, the dispensaries here. You have a representative of a dispensary who has both a dispensary and a CBD/hemp shop, and they keep the two different for primarily one of the reasons, such as the USDA deems that one is legal and one is not. And you cannot. And therefore, when we talk about labs testing in the federal world, the feds and the FDA and the USDA are wanting labs that test hemp products to be DEA certified. The problem is we don't have enough labs in the United States that are DE certified to test the hemp products. So they've granted an exemption and they've said, we're going to delay implementation or enforcement of that regulation until December 2024. You'll note one of the provisions in this particular bill requires all labs who test CBD products to be DEA certified. I don't know if that will happen. We've only got 2 labs right now that are testing marijuana, 2, 3, maybe 3, well, that are actually online. Actively testing, is it 4 that are actively? Okay. The last 3 just came online this year. So I don't know who's going to test the hemp products. These labs can never be DEA certified, the Mississippi marijuana labs, because the DEA deems marijuana to be illegal, and therefore they will not grant them certification to be DEA certified. They can get labs that are DEA certified to test hemp, and those labs are very, very particular. And a lot of these storefronts are using DEA certified labs to test their hemp products and give them COAs and the certificate of analysis. And those COAs are not the ones that you're hearing about where they've gone out to random stores across the United States and picked up just a product and tested it that didn't have what was in there. I think what you'll hear from everybody here, is that this program needs to be regulated. It 100% needs to be regulated. I will remind you that neither marijuana nor hemp are FDA approved for any medicinal purpose. Neither are, okay? So when we talk about, Epidiolex? Okay, there is 4, but Epidiolex is a CBD derived from hemp, and that is FDA approved. And there's some others, but they're derived from hemp, but not marijuana, and they're FDA approved. They're synthetic. They're actually synthetic, but
Well,
we're,
let's try not to have crosstalk and just
I'm sorry.
But-
Well,
with the
they are,
presentation, we'll go from there.
okay, well, the marijuana, these are THC synthetics. They're altered. The drugs are chemically, that are FDA approved, and Epidiolex is from CBD derived from hemp. The proposed bill would require anybody, I think we heard, to get a card, a medical marijuana card in order to get intoxicating hemp and be entered in the PMP program. It will not, okay? It reads as though it does, but it does indicate that they will be entered into the metric system, is my understanding, is it because it brings it in and says that the hemp needs to be brought in under the Cannabis Act. And I think that when it's brought in under the Cannabis Act, except for topicals, and you would need to exclude maybe the quote intoxicating hemp from that and put it in line with topicals to say you don't need to get a marijuana card. Otherwise, dispensaries can only sell topicals and marijuana, but can't sell to anything else without a card. Again, it would need to be entered into the metric system, which I don't know. Things I don't know is that I don't know if it requires repackaging to conform to the Cannabis Act. I don't know. It reads to me as it needs to be entered into metric. And I think we heard earlier that that would be called entering into the PMP program. And that was the first I've heard of that, was just before this, which would be in the medical prescription monitoring program, where you monitor patients and what drugs they're on. But I go back to hemp is not a prescription, and it's not a medical, as our medical cannabis is medical. Some of these things may be time consuming and costly. It will require, it appears, I'm not sure. I need guidance, but it looks like it needs somebody who is licensed to transport medical cannabis will have to transport the hemp products. Notwithstanding all of that, I will tell you that the FDA Farm Bill prohibits states from prohibiting interstate commerce and from prohibiting these products from coming within their jurisdictions. That means that everybody will still be able to buy these products. My concern is that by buying these products online, or Tennessee has a very robust hemp program. They do not have medical marijuana, but they have a very robust hemp program. And they have where they sell all of these different varying products, CBG, CBD, CBN, I think THC 8, THC 10, but they sell a lot of this and they regulate it and they monitor it. People can travel to Tennessee and come back in the state and you cannot stop them from bringing the products in. People can bring them and order them online 24/7. The concern is, and the push is we firmly need to regulate the products. We need to be testing them. We need to have COAs. They need to be sold to 21 and up. They need valid COAs, not the ones that you order from people online. I started into this industry a long time ago and I started dabbling with ordering products online just to see what their packaging looked like to help my cannabis clients so they could see how to label them, because we were already doing this in the hemp world. In that, at first, it required me to show my ID. And I had to put it in a screenshot and prove I was 21 or older. And then it would deliver it to my house. And they delivered it, and my 14-year-old answered the door, and the guy said, "Is your mom here?" He said, "Yes, sir." He said, "Give her this." I opened it up, and there's my gummies. And now I still order it 24/7, and I'm amazed at how they have changed from the packaging and the sophistication. Just like our marijuana industry, it's growing, and it's getting more sophisticated. But now I don't have to give an ID. And they don't card my son, they don't card me, they don't card anybody. It just shows up in my mailbox 24/7. And by that, it's all these other products. I would like Mississippi to regulate them. I don't believe it needs to be limited to being sold just in a medical marijuana dispensary, because I think those two are they're opposite.
Excuse me for interrupting, but we don't have much time left, and I think we want to hear from the people that are with you, and there may be
Yes.
questions, so it might be well to get to a point where we can see if there are questions.
I will. And I think that I'll just tell you that, people can still buy the product. We are for regulating it. I think everybody is in favor of limiting it to for sale for 21 and up, requiring COAs, putting them in a registered shop, but not necessarily killing the shops that are currently in business, because they started before all these other programs. So, and with that, I'll just turn it over to others, unless anybody has questions.
If you have just a moment, is it fair to say that when Congress passed the legislation regarding hemp, they did not think that there would be human consumption involved, that the growing of hemp was the legalization of hemp on the federal level was primarily to legalize products that didn't involve human consumption?
I don't know that I would agree with that, because we already had CBD products that were being consumed. And I don't
Okay.
really agree.
Is it true that hemp has a number of uses that don't involve human consumption?
It has a lot of uses that do not involve human consumption.
Okay. And you mentioned the federal law and the state regulatory scheme. Even though the state can't prohibit this and there are restrictions on interstate commerce, you said we needed regulation. And so it's I think clear that the state can regulate the sale of this product. You have some misgivings about the method that was in the bill the House passed. But I understand you to be saying there does need to be some regulation for the
I
product that's
absolutely
being
agree
sold.
that there needs to be regulation with regard to this. I fully support having it put in a licensed store. I don't know, and I represent a lot of dispensaries that all of them agree that they want this in their dispensaries because of the hassle and because of the uncertainty as to what it's going to entail, like entering it in metrics, packaging, the other things, and the process of having recalls. The state of Mississippi just went through a recall because we had pesticides in our marijuana. And we had to recall, I think, 75% of a lot of the products. And they don't want to have to deal with that with this hemp protocol. They want to focus on the marijuana. And I think that's kind of where the hemp people are. We 100% deal and agree it needs to be regulated. 21 and up, some safety measures.
Do other members of the committee have questions? If not, we have these two gentlemen with you. I'm sure they would like to speak with us. If you just come up and tell us who you are and your.
Good afternoon. My name is Sunny Patel. So I have about 5 smoke shops in this state in basically South Mississippi. I'm not sure about all the statistics. I know there's been a lot of statistics going on here today. I can tell you there's about 581 smoke shops, tobacco shops, vape shops, hemp shops, etc. We're averaging about 40,000 in revenue per month. Our sales tax, that's about 7%. I've actually paid about $22,000 in sales tax in last month on my shops. The reason I'm telling you this is because our smoke shops depend on 2 major categories. Hemp is one of them. If any one of them closed down, then we're keeping the stores open just to keep the lights on. We're not taking anything home. I'm not saying that we need to make a lot of changes, a lot of adjustments. I can tell you, a lot of our business owners, small business owners, we're learning from our insurance companies. Actually, prior to all these statistics, the health department, I could tell you, my insurance company came up to me first and said, hey, Sonny, you guys are selling these, you guys are selling this product. I'm a chemist by nature. I have a bachelor's in chemistry. I have an MBA in management. So the first thing I did is get a COA. Well, that was easy said than done. Years ago, 2020, I think I started my first shop in 2018, and we were barely able to get any COAs. Now, you ask any manufacturers that come up and try to sell you products, they will supply to you. There has been quite a bit of sophistication. The only difference is in the state of Mississippi, we don't have regulations. We don't have regulations like other states. I think Julie and a couple of other professionals from the state can tell you, they probably did more research than me. I'm here to protect my business. I'm here to protect my livelihood. I can tell you one thing, just one person having a bad gummy could probably bankrupt me. 5 stores down the line, $21,000 in sales tax. Okay, that's fine. I think we can take it. Can we take $20,000 in payroll a month? That's my payroll. That's my payroll for smoke shops. I pay about $260,000 to $280,000. This is not my only business, guys. I have hotels, gas stations, Dunkin' Donuts. I can tell you, we are learning to protect ourselves first, prior to you guys coming up with all your stats and all your homework. And that's what we want to continue. How do we protect ourselves that we can stay in business? How do I keep my lights on? That's my question. And that's why I'm here today to ask you guys, how do I keep my lights on? That's it. Any question for me?
What you're saying is that you would like to be able to sell in your store a hemp product which is intoxicating, but you don't object to it being subject to regulation so long as you could still sell it in your store.
I would like to be regulated. I would like the product to be highly regulated, not for the purpose of only that, hey, we have something in the state that can enforce it, but the purpose of insurance, right? I can tell you my insurance rates go quite high. My hotel, we used to pay about $36,000 insurance before 2020. Now we're up to $90,000 just for protection. I don't even know why. Same thing, vape shops, we're seeing these changes quite a bit coming in. We want to protect ourselves, but with these regulations, I think you're bringing a lot more standards that insurance companies can look forward to with their clients as well. So it's a domino effect in a lot of different industries. So yes, we would like to see some regulation and quick.
Thank you. Do other members of the committee have questions? Seeing none, we have one more person to talk to us. Would you
Yes, sir.
tell us about yourself and tell us your perspective on all this?
Yes. My name is Muhammad Al-Qadi, and I'm a hemp retailer here in Mississippi, and I also own a medical marijuana dispensary. I'm also the chairman of a Mississippi Small Business Association that represent over 500 stores who don't have any problem with regulations. That's what we're here for. We're asking for like regulation that will keep this, save the public and save our businesses from closing down. This bill will not keep our businesses. If this bill passes, our businesses will be shut down. We will not have a regulated hemp program. But I'm sure everyone doesn't have any problem with regulations. We're asking for regulations. That's it.
Thank you. Any questions? I see none. Thank you very much. I would say to all of our witnesses, thank you for coming and talking with us. It's been very informative. We're not going to vote on this today, but at least all of us on the committee have a better idea of what questions to ask and what things to keep in mind as we consider the legislation. We now have House Bill 728 regarding the 340B drug program, which had been tabled subject to call. Is Senator, oh, there you are. Is there a motion to take that from the table?
So moved.
All in favor?
Aye.
All opposed? The ayes appear to have it. The ayes have it. Senator Wiggins, when we left off, Senator Blackwell had a question, and I thought you were better positioned to answer it than anyone else. And so I'll ask Senator Blackwell if he wants to ask the question again. And when he finishes asking the question, you're recognized to answer it.
Thank you, Mr. Chairman. He doesn't have to ask the question, Mr. Chairman.
I don't have to, but I just can't help it. I had asked, I think there's this bill, if I recall, there's about 30 other states in which that have these provisions. And I believe I understood that our model came from Louisiana, and Louisiana is the only state that uses or has distributors involved. And ours does. I was just wondering, why did Louisiana do it? Why are the other states not doing it, including distributors?
You are correct that this is modeled after the Louisiana legislation. I can't specifically answer that question. I can tell you that you're correct. About 30 other states are doing this. And to sum it up, this bill is the companion bill to the Senate bill that we passed off the floor. And what has happened on the 340B program is that starting in about, I think it was 2020, makers, other, let's just call it big people, started on an individual basis trying to eliminate the benefits of the 340B program through, I guess, individual states. That's why you've seen different states come forward with these laws that are very similar. Arkansas is another one. And actually, Arkansas passed a very similar bill. It was challenged by the Pharmaceutical Association, and the federal court ruled their law was good, and they put it in a good way. They said you're simply trying to not allow anything to negatively affect the 340B program. We're not mandating anything. We're just saying we're trying to keep you can't go state by state and try to eradicate that, particularly because Congress hasn't done that. So that's a long way to say that specific word. I don't know, but it is modeled after the Louisiana bill on that. And Arkansas has done it. It's been upheld by the federal courts and was challenged on that. And you've seen it upheld in many other states as well.
Senator Turner Ford.
Thank you, Mr. Chairman. My question goes to line 23. And I think I remember raising questions about this the last time the Senate bill came before us. Isn't this additional language or any pharmacy contracted with a participating entity, doesn't it really expand the scope of the program?
So this may be semantics, but what it does is it allows the 340B entities to contract with pharmacies, and this is my term, off premises. Okay, as was done in the Arkansas federal litigation, the court said they're simply an agent of the 340B entity. So the 340B entities don't all have that pharmacy, if you will, on the premises. Therefore, they can contract with these, but the federal, and I wish I had it in front of me, the Arkansas case did a good job of explaining it, that the federal agency that handles these things has interpreted that it doesn't, they're simply an agent. It does not expand the scope of what you're talking about. Now, I will state that I know some people perceive that, but they're simply an agent and allows the 340B entity to carry out, particularly in your rural areas, what the benefit of the program is, which is to deliver drugs at a discounted rate to really your uncompensated population. And we know all the issues we've had with the rural hospitals and things like that. And so by allowing the contract with these pharmacies, they're able to provide that service to those areas.
And so the 340B drug is a drug that is manufactured by a company that has signed an agreement with the federal government saying that they will limit the price.
I don't know if, I can't answer your question if that manufacturer says that, but Congress through the 340B program has said these entities are a 340B entity, and therefore they will receive these drugs, what you could call a 340B drug, at this discounted price.
And then for the 340B drug is for this manufacturer that has signed an agreement. The 340B entity is the organization that has submitted an application and they are certified as a 340B entity, as the circular. But the point is the 340B entity would usually be a hospital that has an in-house pharmacy. Could be.
I mean, could be, but that's why yes, it could be.
And so it's my understanding that's the 340B program, but actually as we define it, by saying, or any pharmacy contracted with the participating entity, you're going beyond those entities that have actually submitted an application to the federal government.
And with all due respect, the argument you're making is the argument that, and that the pharmaceutical manufacturers started in 2020 going state by state to say that shouldn't apply to us, and therefore it gets them, they want us to believe that, let me put it that way. And that was the crux of the Arkansas litigation over this bill, very similar bill. So no, it doesn't, if you want to say it expands it, it certainly expands the benefit of the program, which is to allow those who are less fortunate, the uncompensated care, to have the benefit of discount drugs. That's why Congress set that up. And the entity, as I've said when we were doing the Senate bill, generally are your your hospitals, UMMC, I mean, hospitals across the state support this, the UMMCs, the Northeast Medical Centers, the Memorial, the Forest Generals, they all support it because they are getting uncompensated care at a tremendous rate. And this will, the program, this bill only keeps the program in place. That's what it's doing. If this was not allowed to happen, then it cost them really hundreds of millions of dollars. So we're just simply trying to keep it in place.
Doesn't this bill attempt to limit the federal program?
No, it's simply, it keeps things in place as they are. I don't think we could limit and let me say this, in the Arkansas case, the argument was made to the federal court that Congress had preempted this area. And so therefore Arkansas couldn't have a bill similar to this. What the circuit, whichever one, the circuit court ruled was that Congress, because they left things open, they did not intend to preempt, and therefore the state could regulate or could have a bill like this, and therefore they upheld the Arkansas case, the Arkansas legislation.
And the Louisiana legislation is still pending.
As far as I know, yes.
And this was just one of the provisions that stuck out at me as I was reading through it. Going over to line 108, which basically says that an entity cannot be required to compel the submission of ingredients cost, pricing data pertaining to 340B drugs, to any health insurer. So does that provide some level of cover for those manufacturers that other manufacturers may not have that have actually applied to be a part of the program?
I don't understand your question about cover.
It seems as though this is an exception for these other contracting pharmacies.
I don't
They're
think,
contracting with the 340B entity.
okay,
They're not required to provide their ingredients or the components of their prescriptions.
I don't think that that's what that says. But again, the whole point of this bill and all the 30 other states' bills are to simply keep the 340B legislation and benefits in place. Also, I think it's important to note that this bill is fully supported by the federally qualified health centers. And this bill is tremendous for them. And because of the benefits that it brings, or if the pharmacies started doing what we're trying to prevent happening, it's going to cost them tremendous amount of money and arguably put them out of business. So again, they're in our more vulnerable populations, and that's why we want to do it. But that language right there, I don't think it says that. What I think it's doing is simply stating you don't have to, that they can't do the list of all the other things as well.
Thank you.
Further questions,
No
If-
further.
comments? If there's nothing else, the vote recurs on the motion, title sufficient do pass on House Bill 728. All in favor say aye.
Aye.
Opposed, no. It appears the ayes have it. The ayes have it. We'll report that bill. We do intend to meet tomorrow. The committee will meet tomorrow at 3 p.m. at our regularly scheduled time. Is there a motion to rise and report? All in favor say aye. Opposed, no. The ayes have it. Thank you.